Let's talk about one of the most controversial topics in birth today, unassisted births, or sometimes known as free births. My name is Jamie. I'm a midwife. I've been attending births for over a decade. When we're talking about a planned unassisted birth, we're discussing births where the parents have chose to intentionally not hire a medical provider, such as a doctor or a midwife, although they may have family, friends, or hire a doula for emotional and physical support. Often this choice comes from a general mistrust of the medical system, but it can also be for other reasons, such as wanting complete privacy, the cost of medical bills, or midwife fees, or the belief that birth is a natural physiological process that doesn't need to be managed or interrupted. For some families, the experience can feel deeply empowering, but it's important to understand the risks and realities in choosing an unassisted birth. First, I want to be completely honest. There is absolutely no risk-free birth, no matter who's attending it, where it takes place, whether it's an induction, a C-section, or a free birth. Even low-risk births can have unexpected and unforeseen complications. What we do know is there is a lot of research for midwife-attended home births, and overall, the outcomes are generally very good. Unfortunately, not enough research has been done to conclude the outcomes of unassisted births. The little amount of data collected on free births or unassisted births shows there is an increased risk to moms and babies and emergency transfers compared with births attended at home by professionals such as a midwife. Now, those statistics don't capture the stories or motivations by the individual, but they do show that having a skilled attendant, someone who is trained to recognize and respond to complications, makes a real difference when things don't go as planned. As a midwife who attends home births for low-risk women, my personal experience is 90% of the births that I have attended would have been fine if I wasn't even there. But for 10% of the births, it made a significant difference to have someone capable of handling the complication for the outcome of the birth. The medical system is complicated and it doesn't offer individualized care, and it is every person's right to choose where they want to give birth. The increase in popularity of the free birth movement highlights a bigger problem in the maternity care. Lack of respect, limited access to midwifery care, and a broken system that pushes people away rather than supporting them. If you are planning or considering a free birth, there's some really important things to keep in mind. First, make sure that those who are around you support and are informed about your decision. It's really easy to feel supported and empowered when you're in groups of women and families who are talking about their positive birth experiences, who are discussing these emergencies and how to manage them, while not in the moment, but in the moment of labor and birth, you are not going to have access to those people, and the people that you do need are the ones that are surrounding you and planning on supporting you in person. Knowledge does not replace experience. You can study every birth complication out there, but in the moment, labor is intense. Pain, exhaustion, or being deep in labor land is going to cloud your judgment, and you may not even realize when an emergency is present, even for people who have read all the right books. Alternative options are have an honest conversation with your provider, or find a provider who you feel like respects you and is willing to have open conversations and respect your wishes. This may take a while to find somebody who aligns with your beliefs. This could be a doctor with a smaller practice, it may be a home birth setting, or it could even be a birth center setting. Find someone who prioritizes spending time prenatally so you feel like you're on the same page when it comes time to give birth. If one of your reasons for considering free birth is you want to limit interventions and prevent C-sections, it's definitely worth considering hiring a doula and considering laboring at home to decrease the amount of time that interventions could occur. Unless there's a clear medical indication, you always have the right to decline an induction or a procedure. My role as a midwife is to advocate for safe and supportive births. If you're planning a free birth, I encourage you to educate yourself and those around you deeply and plan for emergencies. A hospital is there for emergencies, so should you find yourself in labor and questioning your choices, you can choose to change your plan even in labor. If you're unsure what's right for you or feel like you can use some more personalized guidance, I offer one-on-one virtual support. Check out the link below to find out more. Birth should be empowering, but it should also be safe. You deserve both.